After your full arch replacement, it is important to properly care for your mouth. Following these post-operative instructions will promote healing and deliver optimal results. Intermittent bleeding or oozing is normal. Bleeding should never be severe. If it is, try repositioning fresh packs to allow you to place firm pressure over the area. Always hold pressure for a minimum of 45 minutes to an hour at a time. If bleeding persists, you may substitute a tea bag for the gauze. Wet the tea bag with hot water, squeeze it damp, dry, and wrap it in a moist gauze. Apply pressure over the surgical area for an hour. If bleeding remains uncontrolled, please call our office. Gauze will look light pink, spotted, or rust-colored when bleeding is controlled. When bleeding is controlled, gauze may be left out. Often, there is some swelling associated with oral surgery. You can minimize this by using a cold pack or ice bag wrapped in a towel and applied firmly to the face or cheek adjacent to the surgical area. This should be applied 20 minutes on and 20 minutes off for the first 48 hours after surgery. In nearly all cases, if you experience nausea, it is most likely from your prescribed narcotic pain medication. Allow the nausea to subside and take a smaller dose at your next interval. Often, breaking the tablet in half is sufficient to control pain without nausea. If nausea persists, please call our office. Take out the gauze packs while eating. Eat only a soft diet for 6 months. This time will be specified by your doctor. A soft diet is described as nothing harder than scrambled eggs. Avoid extremely hot foods. It is important not to skip meals. If you take nourishment regularly, you will feel better, gain strength, and have less discomfort and heal faster. Do not use a straw, spit, or suck on anything. If you are diabetic, maintain your normal eating habits as much as possible. Follow instructions from us or your physician regarding your insulin schedule. Do not disturb the surgical area today. Do not rinse vigorously or probe the area with any objects or your fingers. Do not smoke for at least 7 days, since it is detrimental to healing. Begin your normal hygiene routine the day after surgery. Soreness and swelling may not permit vigorous brushing of all areas, but please make every effort to clean your teeth within the bounds of comfort. Do not use an electric toothbrush around your implants until your surgeon gives you authorization. Usually this will be in 4 to 6 months. Do not use a water pick or electronic flossing device. Be aware of any other device or mechanism that can introduce vibrations. These devices can cause implant integration issues. If you are given an irrigating syringe, start using it the 5th day after the surgery to keep the sockets clean. Mix a half a teaspoon of salt dissolved in a glass of water. Fill the syringe with warm water and irrigate any open sockets gently, especially after eating. If you feel sharp edges in the surgical areas with your tongue, it is probably the bony walls that originally supported the teeth. Occasionally, small slivers of bone may work themselves out during the first week or 2 after surgery. They are not pieces of tooth, but if they are bothersome, we will remove them. Please call the office if you are concerned. Keeping your mouth clean after surgery is essential. You have been given a prescription for Paradix oral rinse. Rinse for 30 seconds with 15 milliliters of Paradix twice a day. Use Paradix only during the first 2 weeks of healing. Note: Paradix may cause alteration of taste perception during use and may increase staining of teeth and other oral surfaces. To avoid this, use Paradix only during the first 2 weeks of the healing process. There is no need for prolonged use. Do not eat or drink for 30 minutes following the rinsing. From the 2nd until the 6th week after surgery, use Superfloss to gently floss the areas and lightly polish with an ultra-soft toothbrush and warm water. After 6 weeks, brush and floss as normal, but do not use a mechanical toothbrush.